Hello, everyone. I'm Dr. Carmen Pugliafito, and I'm here today with Dr. Dilsher Dhoot of California Retina Consultants on retina synthesis. Dilsher, welcome back to the program.
Hey, Carmen, thanks for having me.
Uh, Ocular Therapeutics recently released its results on the Helios trial, which is a study of looking at their TKI implant in diabetic retinopathy. Can you tell us a little bit about the trial?
Sure, yeah, this was the 40-week data, so 10-month data for AXPAXLI, previously known as OTX-TKI. And this was looking at a population of patients with level 47 or 53 non-proliferative diabetic retinopathy, so moderately severe to severe NPDR, without diabetic macular edema. The trial was conducted at 10 different sites around the country. And patients were randomized in a 2-to-1 fashion to receive either AXPAXLI or control or sham. And so this was the results in the press release from the 21 patients that were enrolled in the trial. The primary endpoint for this phase 1 trial was treatment emergent adverse events. And then key secondary endpoints were changes in DRSS, visual acuity, OCT, and proportion of patients that required rescue. And so that was the basic structure of the trial. The top line results, we saw that 46.2%, or 6 out of 13 patients treated with AXPAXLI had either a 1 or 2-step improvement at 40 weeks compared to 0% in the control arm. It turned out that 0 patients treated with AXPAXLI had any worsening in their DRSS compared to 12.5% in the control arm. And so in totality, the results demonstrated a durable effect with AXPAXLI out to 40 weeks with no undue safety events.
Well, that's a very exciting result. What role do you think this implant could have in clinical practice in the future?
Well, yeah, that's a great question, Carmen. Currently, despite clinical trial data to show that VEGF inhibition can reduce vision-threatening complications in this population of patients that are level 47 and 53. The gold standard really is to continue to observe them, as we've seen amongst the community. This is due to really the burden of injections in this population. And so having a durable treatment that could potentially be given every 9 to 12 months to this population that does not have diabetic macular edema may be quite beneficial to them, and shift the risk-benefit profile towards treatment. And so I think ultimately would result in less in the way of vision-threatening complications with a reduced burden in the population.
Can you say a little bit about the implant for those members of the audience who might not be familiar with it?
Absolutely, yeah. The OTX-TKI implant is a combination of EluTex technology, and EluTex is OTX's proprietary bioresorbable hydrogel platform, and it's combined with axitinib. And axitinib is a potent tyrosine kinase inhibitor that's highly selective for all VEGF and PDGF receptors. It's different than a typical anti-VEGF that we inject, which acts, at the extracellular level, blocking the interaction between VEGF and its receptor. This is actually working at the intracellular level, and so this prevents phosphorylation of the receptor tyrosine kinase of the VEGF receptor, and by doing that prevents tyrosine kinase phosphorylation and the resulting signaling cascade. So it works on the intracellular level.
That's exciting. What are the plans for further evaluation of this device?
Well, we should see the full data set presented here at an upcoming meeting, and then we should see also then the 52-week data. The sponsors indicated that they will be proceeding toward a phase 3 trial and are currently in discussion with the FDA. So it's quite exciting to see, where this will go. Of course, they've already initiated their first pivotal trial in neovascular AMD also.
Well, that's great. Dilsher, thanks so much for your time today.
Hey, thanks for having me, Carmen. It's always a pleasure.